on to the next one. The next one is very dear to my heart because my boys always has this issue. So diarrhea and vomiting. So how often do you see such cases in the clinics?
I would say that we do see it, unfortunately, every day as well, like vomiting and diarrhea, or vomiting or diarrhea. So both dogs and cats do get it, and it can be caused by many, many, many reasons. The most common will be due to the diet, actually. When we suddenly change their diet, when they have this sudden new treat or snack that they take, or sometimes they have food that's too rich. Okay. Yeah, then the other one is sometimes when, like, not so much for cats, but more common for dogs, when we bring them for walks, they like to sniff the ground. So sometimes they may pick up like Giardia and Coccidia and other bacterial infections because it stuck on their nose, they lick it and they get like food poisoning on the inside, especially if they got sensitive tummy. Because Singapore dogs, like Singapore people, have got very sensitive tummies.
Yes. Yeah, unfortunately. So, I mean, for my dog, because since young he has always had this issue, and then he was diagnosed with IBD. So we see it so often, and we are so afraid of feeding him anything. Every time we want to feed him something new, we give him in like such small quantity, and then we observe.
Yeah, it's a good idea.
Yeah, but poor thing because he don't get to try a lot of things that maybe other dogs get to try. But with his condition, we can't really risk it.
True.
Yeah. So is there a certain type of the year that cases like this happens more often?
I guess it does happen more towards the end of the year and the beginning of the year, due to a combination of reasons. One, somehow we get a bit more of this sort of like food poisoning cases where they get like Giardia, Coccidia and stuff due to the rainy weather. And then also, nowadays our poor parents like to like treat their pets with a lot of like Chinese New Year and Christmas treats. So sometimes the food may be too rich, and then the sudden change in the diet might also trigger the tummy upset. Like I was looking online, now they have like they have those like treasure pot for their pets to eat for Chinese New Year. So yeah, in small quantities it's okay, but in large quantities sometimes it may cause a tummy upset if they're replacing as a full meal with a dog with sensitive tummy.
Like with all their prawns and oysters and everything as a whole.
Correct.
Yeah, I see nowadays they really put a lot of effort to do all these kind of pencai things. Have you seen, Dylan?
Okay, yes, I did see that. Like when you talk about Chinese New Year, like let me, it reminds me about my wife. Like when my dog birthday, my wife tend to give her a lot of special food, like home cooked food, something additional treats for them. Yeah, that is where I realized that my dog start to have diarrhea. Yeah. So normally when my dog is on normal kibbles, nothing will happen. Yeah.
It's only when you start adding.
Yes.
So any Chinese New Year food that's a big no-no, or like certain human food that's a big no-no for
Bakwa?
Yeah, I would say definitely bakwa, because bakwa is very oily. Okay, so it can trigger pancreatitis, and it's also very high in sugar and salt, which is not ideal for them. Pineapple tarts are another one because it's very, very rich. So that's more of your Chinese New Year goodies that we do try to avoid. In terms of Christmas, I would say that chocolates are really a big no-no for the dogs and cats. Then cakes also, because sometimes they're a bit too rich, it can trigger like tummy upsets for them.
Okay, so yeah, pet parents need to take note of all this.
Yeah.
So what kind of demographic of pets do you normally see with this issue?
We see probably more dogs than cats with tummy upsets, and they do vary in age, so there's no like particular age group that has like diarrhea and vomiting more often, because it can start from puppies as young as like 2, or kittens as young as 2-3 months old, all the way to your like 16-year-old dog that has it.
Okay, so it's really a wide range.
Correct.
Right. So are there cases whereby they have always had pretty healthy gut and never really had digestive issue, but once they reach a certain age, suddenly they just start having all these issues?
Yeah, it can happen. So some pets, like your pet who has IBD, you may notice that it was really good and suddenly something happened, and then almost anything will trigger it to have vomiting or diarrhea or both. So IBD is one. Okay, another one that sometimes some pets may develop, they may develop like other diseases, like sometimes they get Cushing's disease or they get thyroid issues, so they get tummy upsets more often. And unfortunately for certain breeds of dogs, like your retrievers and your cocker spaniels, because they're like little vacuum cleaners, getting a foreign body is quite common. So they eat something which is not edible, they can't digest it, it gets stuck in the gut, and they will have like vomiting and diarrhea. And for those cases, unfortunately, quite a number of them will require a surgery to remove it out for them. Yeah.
Oh, okay. Yeah. Is your dog a bit like a vacuum cleaner?
I would like to say yes. He eat whatever he sees.
Okay, so when should they seek veterinary advice?
I would say it's a good idea. You don't have to see the vet immediately once the dog has got vomiting or diarrhea or both. Normally, I would advise clients, if the pet is still bright, alert, is still eating, okay, it doesn't seem to be painful, uncomfortable, we can wait for 24 to 48 hours. So we'll normally like withhold food for maybe the first 8 to 12 hours, and then we give them very bland food, like it may be like egg white or like chicken breast with a bit of white rice. So it's something more digestible, and see if the problem clears up. So if we find that, hey, it's lasting for more than that, or if my pet is really lethargic, it doesn't want to eat, or is having both vomiting and diarrhea, or we notice, hey, there's blood in the poo or blood in the vomit, or my poo becomes really like dark and sticky, then I'll say, yeah, bring it to the vet ASAP.
Okay. I don't know whether is it because my dog has a condition, right, that the minute I see that the poop is a bit softer, I'll bring him to the vet immediately, because I've seen how it can escalate. So is it also dependent on whether the pet has a existing condition? Or am I just overdoing it, like just too scared already? The minute I see it, it's like I'm going to the vet.
I guess it depends on the condition. So for pets with IBD, I would say that if the pet is still happy, is still eating, and the poo is just a bit soft, I might just wait as well for like a day to see if it gets worse or not. Because with IBD, it does go, it's good days, it's got its bad days and good days. So we'll just see if the good days get worse. So if we notice, hey, they're starting to have blood or it's not eating, then I'll say, yeah, probably bring it to the vet already.
Okay, understand. And we also know that some pet parents may use natural remedies, such as pumpkin puree. We've seen when we Google, ginger tea also appears. So what are your thoughts on that?
Yep, I would say that they're actually quite good stuff that they can use on their pets. You can even use it long term with your pets, because ginger is actually really good for digestion, and it helps to get rid of the wind a little bit in the tummy. But we must be careful not to overdo it, because it can irritate the tummy. Okay, with pumpkin puree and even sweet potato, but pumpkin has got higher fiber than sweet potato, so the fiber does actually help with the gut as well. So pumpkin is good. It's really strange. Pumpkin is good for both pets with diarrhea as well as constipation because of the fiber in it. Yeah.
Okay, so you can use it both ways.
Yes.
How about vomiting? Can they also use pumpkin puree?
I won't use pumpkin that much for vomiting. Yeah.
Okay. So when the pet parent brings in the pet, so what can they expect as a treatment plan?
That would really vary, and depends on what the pet comes in for. So if it's like just vomiting, we'll normally just get the history as well to see if there's been any like change in the diet, any new food that they may have introduced recently, or whether they might have brought the pet to a new place recently because they may have picked up something there. And then also we'll sometimes check their vaccination history as well to see, because certain infectious diseases can actually cause vomiting and diarrhea. Then after that, we would also check the pet to see, like, in general, whether they are dehydrated, and then also whether or not they are in pain, and if they are in pain, like which part of the tummy is more painful. We also feel the tummy to check whether we can feel any possible foreign body, which is something that they may have swallowed that is not digestible in there. And then that will be more for the vomiting. And with diarrhea, it follows along the same line, but we will try to check their stool sample, because with the stool sample we basically check them for like Giardia, Coccidia, we check them for worm eggs. and also whether there's any abnormal overgrowth of bacteria. And then we'll try and address those issues for them.
And what can pet parents do to prevent diarrhea and vomiting or constipation?
Okay, I would say that the number one would be the diet. So if you're doing any diet change, do it gradually over at least a week so that the tummy can get used to it. And like say for your pet, because it's got IBD, introduce any new things slowly and see if there's any like adverse reaction to the food. Okay, and also if possible, when we bring our pets out for walks, we try and like keep them off like dirty places or places that may not look so clean to minimize the chance of them picking up diseases. And then also vaccinating will be good because like parvovirus and distemper can cause really bad vomiting and diarrhea. So vaccination will really help with those issues. Yeah. But I'll find that a lot of cases sometimes nowadays we see a lot of pancreatitis, and pancreatitis does cause vomiting and diarrhea or both. So those is really unfortunately dietary in some cases, whereby they have too rich a food, too oily a food for dogs. So diet is actually really important.
Are there any common things that's being fed to pet that seems to cause pancreatitis more than others?
I would say any food that may be too rich or oily may cause it, like salmon sometimes can actually trigger it. So pancreatitis is really strange. For some pets, they can eat a very high fat diet and they will never get pancreatitis. But another one just has to have a little bit of oil in it and it will trigger, because it's basically their genetic predisposition to having it already. And then we just trigger it by giving them too rich a food, or sometimes when they take certain medications also it can actually trigger pancreatitis.
Medications as well?
Yeah, so sometimes steroids can actually trigger pancreatitis in pets.
Oh,
yeah.
Oh, that's interesting.
Yeah.
Okay, so great. Let's move on to our next condition, which is kidney issues. So how often do you see kidney cases in the clinic?
Okay, we do see kidney cases quite commonly, and they normally happen in the older pet, like the older dog or cat, as a result of aging, like chronic renal failure. Very occasionally, like maybe once every few months, we may see like acute kidney failure, whereby they got kidney failure as a result of like an infection or due to a toxicity issue. But majority of them will be due to old age, where they get chronic renal failure. Yeah.
So the acute kidney failure, is it something, I'm not sure, because recently, last year I went for a CT scan, and then they had to inject the dye in, right? And then the doctor was telling me, oh, there's a chance that it can affect your kidney, but it's reversible kind of thing. So is it things like this that could cause?
Yes. So it could be things like that, yes. So certain chemicals that they may consume, or like sometimes they get poisoning. Not so common now because more pet parents are educated about it, but like certain plants like lilies can actually trigger kidney failure in pets, and really fast over a day or two.
So pet parents must really take note of that, because I think like Valentine's Day, some, husbands will give lilies.
Yeah.
Yeah, okay. And are there any breeds or species that are more predisposed to this?
I would say in cats, yes, it's a little bit more predisposed. So like certain breeds of cats, like your Persians, your ragdolls, your Maine Coon, they get polycystic kidneys, whereby they are born with like little cysts in the kidneys that get bigger and more numerous as they age. So it affects the kidney structure, and therefore they get kidney failure a little bit earlier. Then your Siamese and your Abyssinian cat, some of them get amyloidosis, whereby it's deposits of amyloids in the kidney that damages the kidneys. Yeah.
Okay. And so it's more like for cats that there's a more specific breeds for kidney disease.
A bit more. For dogs also, there's some genetics, but it's not as obvious as in cats.
I see. Okay. And what are the signs or symptoms that pet parents should look out for?
When the pets get kidney problem, when it's acute, it's really obvious, because the pet will be vomiting, will be diarrhea, not eating, lethargic. It looks really sick, so that's really obvious. when it comes to chronic kidney failure, because unfortunately it affects most of the older pets, some owners may miss the signs initially because they think it's just my pet getting older, whereby they start eating a bit lesser, they start losing weight, so they assume as part of old age. But we'll say that very commonly for a lot of pets with kidney failure, they will drink a lot and they pee a lot. So for cat owners, they may notice, hey, I see a lot more clumps in my cat litter that I need to clean. Or for the dogs, they may notice, hey, my dog is having accidents at home, or it keeps wanting to wants the owner to bring them out for a pee. Yeah.
So that's one of the key signs that they should look out for. Right. From what I understand also is that when it comes to kidney disease, it also affects the appetite of the pet, as in their taste bud change. Is that true?
A little bit, because of the toxin build up, it does affect their appetite, and it may also sometimes cause nauseousness for them. So, and some of them may also develop gastric issues. More common in dogs than cats that they have gastric issues and gastric ulcers. And then also due to the toxin build up, some of them develop like mouth sores. So then it makes them uncomfortable to eat. That's why they are less wanting to eat as well.
Okay, I see. So could we say that because the symptoms sometimes could be misunderstood as old age, that it's actually more important that pet parents do at least a yearly checkup for especially their aging pets when it comes to this, so that vets can pick it up earlier?
Yeah, I'll say it's a good idea. Like now the trend, similar to humans, we are going more towards preventative health care than actually addressing it. Like addressing a problem that comes, you're trying to prevent it from getting worse, we pick up early. So for most middle-aged pets, we'll say it's a good idea, like once a year when we go for a vet checkup, we'll do a physical exam to see whether there's anything wrong that we can possibly see or feel with your pet. But at the same time, we might do some blood tests to check like the kidney function, the liver function, the blood sugar. We also check the blood values as well to see if my pet is anemic, because some kidney patients will become anemic as well as it progresses. So doing all these tests earlier in our checkup helps to pick up the disease, hopefully in the earlier stage of kidney insufficiency before it reaches like a bad stage of kidney failure. Yeah.
So we also understand that because kidney disease is not curable, right? So we have to manage it. So what changes when a pet is diagnosed with kidney disease?
So when the pet comes in and we do a diagnosis, we will normally try and stage at which stage is my dog or cat having the kidney failure at. Because say if it's at stage 1, the management will be really different from where it's at stage 3 or stage 4. So say it's a stage 1, that means it's a very early like renal insufficiency sort of an issue, early kidney failure. We don't need to do a lot. We just need to regularly do a checkup, and most importantly for all stages, make sure that there's enough water for them to drink, because it's important for them to keep well hydrated. So even though they want to drink more, pee more, we let them do it. We don't restrict them. Okay. And then we will also try and sometimes restrict the amount of protein that the pet eats, so that the kidneys don't have to work over hard to excrete the excess protein. So we want to have enough protein to maintain the body weight, the body condition, and the hair and the coat quality, but not too much that my kidney is strained. And then we also limit the amount of phosphorus in the diet so that it doesn't strain the kidneys a bit more. And then we may sometimes need to give them like a lower phosphorus diet. So for most diets, when they're lower in protein, the phosphorus will be lower. And in certain cases, as the kidney gets worse, even though I limit the amount of protein and phosphorus in the diet, it's not sufficient, we may need to give them like phosphate binders to reduce the phosphorus in the body. And as the condition gets worse, and it progresses, we might need to like drip them under the skin with fluids so that we keep them better hydrated, especially when they're not eating or drinking so much. And as for some pets, they may get anemic, then we may give them hormonal injections to stimulate the bone marrow to produce blood as well. Yeah, so there's quite a lot of things that we can do for them.
Okay. I think that also comes as like it's comforting in a way for pet parents, at least when their pets are diagnosed with kidney disease. At least, okay, we know it's incurable, but there are a lot of things that can be done for the pets to feel more comfortable and to still live a good quality of life.
Yeah, correct. So like we have some pets when they're diagnosed early, we manage them like when they're in stage 1, they can live for a good like 9 more years still. So we have some that they were diagnosed when they were like about 4 or 5 years old, and now they are like 12 or 13 and they are still alive. And they're not terribly, they have progressed a little bit but not significantly. Yeah. So I guess it's a combination of the pet parents picking up the disease fast enough so that we can sort of try and prevent it from getting worse so fast by managing their diet and their lifestyle. Then also it's how the pet responds to the treatment. Yeah.
Okay, and what can pet parents do to prevent the pets going to kidney disease?
Okay. If it's genetic, unfortunately, there's not much that we can do about it. So, but if we know that, hey, my pet already has got like, say, polycystic kidneys, then for those pets, I would just screen them every year just to measure their kidney function to make sure that they're not in stage 1 kidney issue yet. So that would be one of the preventions. But in the broad spectrum, we'll say that make sure that we do have enough drinking water, make sure they remain well hydrated throughout. In terms of diet, we may not need to restrict the amount of protein in their diet, especially when they are younger, but when they're older, we might want to put them in a senior diet whereby there's slightly lesser protein so the kidneys don't have to work as hard. And if my pet does have a urinary tract issue or has a history of kidney stones, we might want to check them more often as well. Similar for middle-aged to older pets, once a year screening is a good idea to pick up any early signs of kidney issues. Yeah.
Okay. This podcast is proudly sponsored by Mitomax. Want to give your pet's gut health a boost? Mitomax Synbiotics is a powerful combination of prebiotics and probiotics that helps support a healthy digestive system. A healthy gut means better nutrient absorption and a stronger immune system. Did you know antibiotics can disrupt the good bacteria in your pet's digestive system, leading to upset tummies? But don't worry, Mitomax Synbiotics can be given with antibiotics, helping to replenish those essential good bacteria. Yes, we said with, which means no more waiting 1 hour between feeding antibiotics and Mitomax. Visit your vet to learn more about how it can help improve your pet's well-being. So let's move on to the fifth issue, which is the heart problems. So how often do you see heart problems in the clinic?
Okay, we do see heart problems quite commonly, and it normally happens in like middle-aged to older dogs, and majority of them are smaller breed dogs, maybe because Singapore has got small dogs in general. Occasionally we do see in some cats as well, and they tend to be middle-aged cats. Maybe once or twice a year we will see some puppies that are born with a congenital heart issue, but those are the rare ones. But majority of them will be middle-aged to older pets.
So for the puppies, are they mostly, is it genetics?
Yes, it's mostly congenital. So majority may be genetics or they are born with a defect in the heart. And some of them may be correctable surgically, some might not.
Okay. So it's also important when people get puppies also to do a health check first,
yes,
right?
It's a good idea, yes.
Okay, and what are the common causes of heart problems?
So if it's a young puppy, it's normally a congenital issue. If it's an older pet, it's likely to be a degenerative change from the valve of the heart muscles not working so well. And very rarely is it a progression from their congenital issues that progressed.
Okay, and are there any breed or species that are more predisposed to heart conditions?
Okay. So for the dogs, we'll say generally it's like the smaller breed dogs, like what we were talking about before. So like your Chihuahuas, your Maltipoos, your Pomeranians, those are quite common to get heart issues, whereby they have like congestive heart failure. And certain breed of cats, like your Maine Coons as well, they may have something called hypertrophic cardiomyopathy, and then they are more predisposed to having the heart issues.
I see. Okay. And what are the signs or symptoms that are commonly seen?
So one of the common things that we notice, especially in the middle-aged pet with the congestive heart failure, one of the first signs is that they just get tired more easily. They're a bit more lethargic, which some owners put down to old age. Then later on, as the disease progresses and advances, we may notice that they get exercise intolerance, whereby they used to be able to like walk for 10 minutes. Now they walk for 5 minutes, they're exhausted. Then we also notice their breathing. They may breathe a bit heavier, they might breathe faster. So for pets, once we diagnose them with heart failure, we do get owners to monitor their breathing to see if their breathing rate actually goes faster as well. Then for dogs, not so much for cats, is we may notice they start coughing. Okay. And for both dogs and cats, we may also notice sometimes fluid pooling in the chest, so they have problems breathing, or sometimes the fluid will pool in the tummy, so they get a bloated tummy. And occasionally some of them, like humans, may get like swelling of the limbs, but swelling of limbs is a lot less common. And then later on, at the more advanced stage, once they have all these signs, some of them may also develop weight loss. Yeah.
Okay. And so when should pet parents seek veterinary advice?
It's a bit challenging. I guess any middle-aged dog, once we notice that, hey, my pet is breathing a bit harder, it's having a bit of exercise intolerance, it's a good idea just for a checkup first, even though they already had their yearly checkup, just to have another additional checkup. Because most of the time at our yearly checkup, we will actually listen to the heart and lungs as well. So if we do notice that there's a heart murmur, we may sometimes already ask owners to do like further testing to check to see whether are they already showing signs of heart failure. So if we pick up heart failure, like say at the early stage at like B1 or B2, they can be actually managed quite well still.
Okay, and if the pet is diagnosed with a heart condition, so what needs to be changed? Like lifestyle changes or like?
It really depends on which stage of heart failure my pet is at. So if it's in the very early stage, even at like say B1, we don't need to take any medication. We don't need to make major changes for the thing, except that we might want to restrict the amount of salt in their diet a little bit so the heart doesn't have to work too hard. But of course, as it progresses, we need to do more for them. So then what we may do later on, like say when they reach B2, we will definitely say restrict the salt even more. We may start them with certain heart medications to help the heart work more efficiently. And then as it gets worse, because they get fluid in the chest or the tummy, we may actually give them medication to draw out the fluid. And at some of these stages also, some of them may start to eat lesser because their appetite is not good. So we may look at their nutrition to give them an energy-dense diet to make sure that they get enough calories in, that they're not losing weight too much. And at that stage, sometimes it becomes a balance of, do we give them food that they want to eat that might be bad for them, or do we let them starve? Okay, and also starting them on supplements will be good as well, like taurine, coenzyme Q10 and stuff like that.
So what can pet parents do to prevent this? Is there anything that they can do?
Okay, in terms of prevention, not a lot. We'll say that if I know that my pet is already a predisposed breed to getting heart problems, like say I've got a Maine Coon, so we might do like a blood test, a pro-BNP, to check a bit sooner if it's showing signs of any heart stress. Or if a King's Charles Spaniel, because King's Charles Spaniel also tend to have heart issues, or small breed dogs, we do our yearly checkup to check for any issues. And if we find there's any issues, we may want to do further investigations like ECG, ultrasound of the heart, or even x-rays of the chest to check. But more importantly, I would say that we try and make sure that the pets are not similar to humans with heart problem. We make sure they are not overweight, they have enough exercise, they have got good nutrition. Yeah. And also another thing I forgot to add is heartworm prevention. Because heartworm now is a lot less common because most pets are on it, but if they're not on prevention, they could still be at risk of getting heartworm, and heartworm can cause heart disease and heart failure. Yeah.
Okay. All right. So, we went through quite a few conditions, but overall, Dr. Audrey, what are the key things that you feel pet parents can do to help their pets stay healthy or have a better quality of life?
So I think that preventative medicine is really important, like putting them, make sure they're on a vaccination program. If they're not on it, at least do an antibody titer test to make sure they're adequately protected against like viral diseases. Then also addressing to make sure that they are on like parasitic control, like for heartworm prevention or intestinal deworming as well, or like flea and tick prevention. And then also maintaining dental health, because I believe that dental health is actually really important, because it doesn't just reflect the bad breath or the bad teeth. The bacteria in the mouth can actually cause other issues like kidney issues, heart issues as well. So I really believe that the dental issue is really important for them. Yeah.
Okay, yeah, I think that we really learned a lot today, Dylan.
Yeah, I think I learned quite a lot today also.
Yeah.
Yeah.
Yeah, and we really hope that the pet parents will really have more information on all this, and also that the importance of preventative care as well. Yeah, so thank you so much, Dr. Audrey, for your time.
Okay, welcome.
Yeah, thank you, everyone, and we will see you in the next episode.
Thank you.
Thank you.
Thank you.